Veins are part of the circulatory system. They return venous blood to the heart. Once venous blood gets to the extremities, it needs to be returned to the heart somehow to continue to circulate. Veins have valves. Venous disease generally develops when vein valves don't work properly. It can be as simple as a cosmetic issue where you have large or prominent unsightly veins. That can progress to, if the blood is static, meaning it's not moving, clots can develop in those veins. The most common form of venous disease would be varicose veins. That affects women disproportionately. Estimate is that by age 50, about 40% of women will have clinically significant varicose veins. More serious consequences of venous disease would include deep vein thrombosis or phlebitis. The problem with deep vein thrombosis up front is a life-threatening consequence of a clot breaking off in the leg, traveling to the lung, causing you to have trouble breathing or have your heart have trouble functioning. The treatment options for those include treating with blood thinner, which can be done either passively or more aggressively. We can use a catheter-directed procedure to actually actively remove those clots. Treatment options for varicose veins and more common vein disorders depend a little bit on the manifestation. Some people find that they have prolonged standing, they get leg swelling, pain, discomfort. That can be effectively treated just by wearing prescription-grade compression stockings. Traditionally, a more definitive long-term treatment would be stripping those veins out. That involves a variety of surgical exposures and usually a general anesthetic, perhaps up to 2 weeks recovery period after the procedure, but good long-term treatment and symptom relief from that. We can introduce a venous catheter into the vein that needs to be treated, advance under ultrasound guidance to the end of the vein, and then sequentially pull the catheter back through the vein, treating the vein from the inside out. It generally takes 30 minutes to an hour. Patients recover for 15-20 minutes in our recovery room. They get a ride home and they're back at work with no restrictions the next day. There are very specific and effective prevention measures, for example, to prevent deep vein thrombosis. That would include avoiding high-risk environments. For women, don't take birth control pills and smoke cigarettes at the same time. For people on long-haul plane flights, make sure you stay well hydrated, move your legs frequently, get up and walk around the plane whenever possible. Going forward, we have a number of interactions with local device and drug companies looking at combined drug and device strategies for vascular disorders, including venous problems. We have almost a universe of treatment options and specialists with a background in managing both the functional and cosmetic issues of venous disease, which we think can improve everyone's outcome.